So today's exercise is going to have two parts. And this first part, I'm going to show you a little tip that you can do when you are stuck in a chair and you have to sit for a prolonged period of time. It might be at work or commuting or even eating a meal. So something that you can do when you typically are sitting to alleviate the pressure on the pelvic floor and particularly on the posterior or the back of your pelvic floor. So let me demonstrate first of all why you might have that pressure on the back of your pelvic floor. Most chairs and cars tend to put you in a position where you're slightly tilted back at the top of the pelvis. And that puts a little bit of pressure on the tailbone. So I'm actually kind of rocked back off my sit bones and the tailbone is curled under. So now the tailbone is it's a bone and it's a joint where it attaches to the sacrum, and it's an attachment point to some of the pelvic floor muscles. So when you're sitting on your tailbone, you're actually kind of driving it closer to the front of the pelvic floor, and that shortens the pelvic floor muscles. If you think of them like a hammock, you're bringing the tailbone closer to the front like this. So it helps if we can sit up, but it's kind of hard to sit up in a lot of chairs because that in this chair is actually kind of sloped the way a lot of cars are. It just tends to push me back onto that tailbone. So here's something you can do. You can take a blanket or a towel or something like that, and you're just going to fold it up and place it on the back of the chair. So I've got a folded mat here on this chair just for traction because otherwise the chair is kind of slippery. So when I sit on this now, I'm going to place my sit bones on the roll, the front edge of that roll, which automatically kind of tips my pelvis this way. So now I can sit with my tailbone behind me, and I'm sitting more on the 2 points at the bottom of the pelvis called the ischial tuberosities, which we just call the sit bones. And I'm actually pretty comfortable here. It takes a lot of the pressure off my lower back, which is flexed and elongated when your pelvis is tilted back. So this is very comfortable, and it will take some of the pressure off the tailbone and the posterior pelvic floor. So I hope that helps. And now we're going to go to an exercise. So one of the exercises that is commonly prescribed for pelvic floor issues is the squat. Now squatting is great, but a lot of people have issues with squatting due to hip or knee pain or discomfort or lack of range of motion in the ankle, etc. And if you have a pelvic floor issue, specifically a prolapse, then standing upright and coming into a squat means that the internal organs are actually loading the pelvic floor. And if you're straining at all, it might increase that feeling of discomfort and heaviness that you can feel when you have a prolapse. So if your goal is to lengthen the pelvic floor and bring that tailbone away from the front of the pelvic floor and to alleviate some of the discomfort of the tailbone, then how do you get the benefit of a squat without all that pressure on the pelvic floor? So I'm going to show you a really excellent way to do that. You do have to be on your hands and knees for a moment, and then you can come onto your elbows. So if you have wrist issues, you won't be on them for long. But you do have to be on your knees for this one. So if that's a problem, make sure you put something down to make your knee comfortable. You can use a folded blanket or a knee pad if you have them, like a gardening pad. So I'm going to place some knee pads down here. And then I'm going to walk out onto my hands and knees and just take a moment and relax my lower back. So what I do not want here is a straight spine or a tucked pelvis. So I find a lot of people when they come onto their hands and knees automatically let them draw their abs in and lengthen the lower back so it's flat. And what I want you to do here is just relax your lower back towards the floor. You can even let your belly go so it kind of hangs towards the ground. So there's no tension in your abdomen, and in your back is just completely relaxed towards the floor. The toes can be flat or tucked. I like to tuck them to get a toe stretch at the same time. And the knees are a little wider than my hips because I'm going to be hinging back and I want some room for my trunk if I get that far. And what I'm going to do is just hinge back and come forward again and go back a few times. And what I'm trying to determine here, it really helps if you can see yourself do this to the side in a mirror, because what I'm trying to determine is how far back I can go without curling my tailbone under and creating that curve here. So I want to remain relaxed. Sometimes what I'll do is just put something like a ball or a couple of balls in my lower back, and then I know if I start to tuck under, they're going to roll off, right? So you want to maintain that relaxed lower back and shift back. Now I'm going to hold that position and just drop to my elbows. So, and you can bring your elbows forward if you're uncomfortable. You can take your knees a little wider, and you're just going to hang out here. So if you look at the geometry of my body, if you were to take a snapshot and then rotate it so that I was on my feet, I'd be in a perfect squat position. So this is a squat. You're able to just maintain this for probably a lot longer than you would a squat. And again, you can relax your feet if you want to, or keep them tucked. I'm just going to hang out here for about a minute. Lengthen the back of the neck. You can let your head hang. You can even put your head down on your hands and relax that. Just hang out here and stretch the pelvic floor for about a minute. Okay, so that's our exercise this week. Hey, did you like that, Mush?